Hey guys, this is Ryan Godfrey, physical therapist with Body Therapy Inc. here in Leland, North Carolina. I want to take time today to just go over a couple assessments that I do with clients to see how their glute function is. Oftentimes glute dysfunction will cause low back pain, hip and knee pain. And the first test I like to look at that gives me an idea of what their posterior chain mobility is a toe touch pattern. Posterior chain meaning low back muscles, glute and hamstring musculature. So I'll have the patient stand feet together and I want them to reach towards the toes, and I'm looking to see one of two things. Are they able to touch the toe, and also are they getting some weight shift backward through the hips? That gives me an idea that they don't have significant mobility issues in the hamstring or glute area. The next test I can check to see if they stabilize well with the glutes is a single leg stance test. So I'll have the patient again, feet together, raising that left leg, holding at hip 90 degrees, knee 90 degrees, holding a 10-second count. If they can't hold a 10-second count, I know that we have something wrong with that opposite hip stability. And oftentimes I'll see that hip drop, telling me that they don't have good lateral hip stability, glute stability. Oftentimes that'll cause low back pain, hip pain, and knee pain in my athletes. The last test I like to look at is an overhead squat positioning. I'll have the patient stand feet shoulder width apart with toes forward, bringing the arms up overhead and dropping down into that deep squat pattern. Oftentimes, again, I'll see caving in at the knee, telling me there's some glute dysfunction here. If I see that again, I know they're not stabilizing very well through that lateral hip. Again, oftentimes athletes will experience knee pain from this, hip or low back pain.